for the session, Dr. Saji, and he is co-founder, D-Direct Innovations and Cardiologist, Medical Trust Hospital in Cochin, and he's going to talk about the smart patient and digital health. So he's going to connect smartness with digital health. Over to you, Saji. Thank you.
After the three electrifying talks, my talk is something very simple, and this is about the smart patient and digital health. Before beginning the talk, I like to make a confession, not one, two. I'm not a technology person. I'm a medical doctor for the last 31 years. You may or may not know, thinking out of the box was never encouraged in medical field. During our college days, during our internship days, we are just asked to follow exactly what was there for the last 30, 40 years. If anybody suggested anything, something new, or an easy method of doing something, they were always looked upon. This guy is really lazy, and the guy is already marked. And it was, the mantra was hard work, hard work, hard work, and the term smart work was not invented at that time. So my talk is very simple, so I'm sure that you will be forgiving me if you don't find anything interesting. First, I'll give you a general overview of these things. These are the contents of my talk, and the talk will contain information about a medical app which we developed to solve some of the problems which I find in healthcare in the last few years, and if time permits, something about digital divide and my conclusions. So these are the things which you must be already knowing about it. Apple Watch, I don't think I should be talking to anybody about it, and remote patient monitoring. And this is the ECG device which a previous speaker was alluding to. I'm not talking about something like this. I'm talking about you about a bigger picture. This is the chronic disease statistics in India above the age of 18 years. You see the incidence of hypertension, 30% above the age of 18 years. Diabetes around 18%, high cholesterol about 30%, heart disease 14%, thyroid 10%, and cancer about 6%. The sad part of the story is the incidence is increasing day by day. There is something called 40-60 principle in healthcare. You must be very well aware of the 80-20 principle. This is something you will not get any reference to this because this is my personal observation. What is that observation? More than 60%, precise 63% of diabetic patients are not controlled. 69% of high blood pressure patients are not controlled. 70% of hospital visits can be done over a video chat or a call. More than 1 year, the incidence of drug non-adherence is more than 60%. I just checked with the consecutive about 30 CCU admissions recently, and I found that more than 60% are due to drug non-adherence. Most interestingly, the consultation time, the doctor-patient consultation time in our OPD, more than 60% is taken for data collection. More than 60% of our patients are not following up with us more than 5 years' time. So what is the importance of that? That is actually causing the secondary downstream problems like heart attack, stroke, and kidney disease. Whenever you hear about any big hospital or something, you hear about a Center for Heart Disease Treatment, stroke treatment, dialysis centers, transplantation centers. But you don't hear about diabetes, blood pressure, and treatment, good quality centers. So, and this even account for more than 60% of the death. So we decided to do something because last year I was invited to write an article about digital health in the newspaper in connection with the World Heart Day. So I was actually homeworking about it and found out that there is such a big problem and we need to do something about it. One of my patients who happened to be the app developer for Paytm, one of the members, I asked him, what should I do? I want to develop a new app for this. His immediate answer was, doctor, you develop an app which makes people lazy. It'll become a bumper hit. I told him, no, I don't want to make people lazy. I want to make life easy for patients. And that is exactly what we were trying to do something cheaper, faster, safer, accurate, easier, appealing, should add revenue, should add value. And that's how we decided to develop an app. Question, can a medical app cure my illness? Absolutely not. But it can save your time, money, and life. With this idea, we had a partner. I have got a partner who is actually a junior to me. He's an IT engineer. He owns an IT company. We decided to form a firm called D-Direct Innovations. It's a health initiative that specializes in digital care pathways. And this is actually named as D-Direct. And the problems. Problem number one we tried to solve. More than 60% doctor-patient consultation time used for data collection. How can we solve this? Number one, we ask the patient to fill in a health profile. Many hospitals are already doing it. Something like they hand over a sheet and they ask them to fill the questions which is actually connected to the EMR. We have asked the patient to fill in a health profile which contains about 50 questions, and at the end of it, after filling this health profile, the patient can actually send it to the hospital email. From there it is downloaded into the EMR. When it is downloaded into the EMR, it will look something like this. If you look carefully, you will see something interesting. This is a patient who, on the left hand side, you will see the patient has got heart disease in 1985, kidney disease 2021, lung disease 2020, prostatic problem, diabetes, hypertension, cholesterol, eye, dental, allergic history, patient had bypass surgery, patient had intracranial bleed, and patient had an aneurysm surgery. To collect so much of data, I need at least more than 10 to 15 minutes to get detail. So even before the patient comes into my OPD, a single glance or within less than 1 minute, I get really rough idea about this patient. Now I just can expand on what all things that is required. This is what happens when the patient sends this report to the hospital email and then it is downloaded into the EMR. We don't have facility to integrate it directly with EMR because the EMRs of different hospitals are different. And this is how it looked like when the patient send this data to me via the WhatsApp. It gives me a instant review or analysis or summary of the whole problems. Now I can expand on it. So I save really a good amount of time with this. You can see the yellow bar where the patient is requesting me to give him a bill to make the payment. The second part of it is the doctor's questions. I have not seen it in any app. See, we are handing over the patient the questions we are going to ask the patient. That is the doctor's questions. I'm going to ask about 20 questions for every high blood pressure patient, another 20 questions for every diabetic patient, and something so on. So the patient is actually going to get a questionnaire. It is something like getting a question paper even before getting into the examination hall. The patient presents diabetes. These are the questions that we are going to ask the patient, and the patient is actually going through these questions and he will be well prepared for it. So if I get to know all the questions my Dr. Rana is going to ask me at the end of it, I'll be well prepared for it, and it will make the consultation time fruitful, and it can improve the quality double, and it can reduce the consultation time half by sending a health profile and going through the doctor's questions. Number two, not a single patient I have seen who does all the tests in single hospital, see all the patients, all the doctors in a single hospital, buy all the medicines from the single hospital and does everything. Now patients are going all over the place. For at least they're coming with a bunch of records. So it's not proper records or no records at all. So we have a medical record system, a tab, which gives into different categories. There is no point in patient handing over a bunch of records. We need to categorize these things, and we ask the patient to do that by just clicking a photograph on this, and it will get automatically loaded into it. Anything that can be measured can be improved. We know that, but the reverse is also true. Anything that needs to be improved has to be measurable. So blood pressure, has to be improved, it has to be measured. Blood sugar, should be measured. And there are different apps for blood pressure, blood sugar, and renal functions, etc. But we just decided to have all these things in a single app so that it will be easy for these patients. I enlisted you some chronic problems. At the age of 45, you will have 1. At the age of 55, you will have 2 on an average. At the age of 65, 3. At the age of 75, 4. If you don't have any of these problems at the age of 75, then it's a manufacturing defect. You will see something like this. This is how the patient sends the reports to it. At one glance, I know what is happening to the blood pressure. The blood pressure is not controlled. So I will get the prescription of this patient and then adjust to it. Problem number 4 is failed follow-up. At the end of 5 years, I just looked through my EMR. Been using EMR for 11 years now. I looked through all of my patients whom I've seen in 2016. I found out that more than 60% of the patients are not following up with me. I got patients from Chalakudi who comes and see me there regularly. And why do they come there? I was just wondering. If they walk into Apollo Atlas Hospital, they find much better facilities and much better doctors. And naturally, you can find them drifting away. So it is important to retain patients. That is not the only reason why patients lose for follow-up. Then we have heard about teleconsultation. We heard about talks about teleconsultation. If we insist only on teleconsultation, there is one problem. Teleconsultation was a hit during COVID times. As a previous speaker was telling, teleconsultation guidelines was relaxed. and the government is now tightening the guidelines. But if we rely only on teleconsultation, for example, if I have got a problem with high blood pressure, I contacted a doctor in Patna. There is no emotional connection. The doctor-patient emotional connect is lacking. So we decided to steal that word, hybrid. Hybrid is everywhere, in the IT field, in the billing field, in the hospital section, everywhere. Hybrid consultation, I think, is a way forwards. We've been practicing it now. We call it as e-consult. The initial physical visit is followed by multiple virtual visit, like our previous speaker was alluding to. And this helps in what is not completing the treatment, but it helps in fine-tuning treatment. And it is important that the doctor stay digitally connected with the patients, and the patients will very secure, and the patient retention is much higher. The last important problem, which I was not aware at least a couple of years back, is this. This is a much bigger problem. It's called medication non-adherence. I don't have a solution for this problem. There are alerts and reminders which we can send. There is an app called MediSafe which is sending reminders periodically. There is one company in Cochin which is called Kaleido Health. What they do is very simple. They make drug packets. So a packet for the morning medication, for the lunch medication, for the dinner medication, and every 2 weeks the patient is going to get a packet, so that it's easy for them. They don't miss medication, and retention is much higher, and they also send patient reminders in between. This, I think, I'm not very sure. I've been using it for some time. I'm not very sure whether it is helpful in some patients, but not in all. So these are the areas of deficiency which I have found out sitting across the table. Improve doctor-patient consultation quality, helping the patient to create a personal digital health record, a digital diary of different readings, tackling the non-adherence of medication to some extent, and also failed follow-up. Most important thing of it all, 3 essentials are required for success of any health tech. One is digital literacy, health literacy. The most important thing is motivation. Patients start with any of these things, but they lose motivation on the way. So this flyer actually summarizes our app. It organizes and store your BP, sugar readings records, and then it helps in tele follow-up consultation. And all these data is backed up in the Google Drive. So what's important here is we hear about a lot of data being transferred, being sold. People are really concerned about using the app because they fear that their data is being sold to somebody or something leaked out or something. So we assure that this data is not stored anywhere else other than the phone of the patient. It's only in the mobile phone of this patient, which is backed up automatically to the Google Drive, so that even if the patient loses the phone, the moment the app is reinstalled again, it is the whole data is downloaded back again. So requesting you to please download this from Play Store, from DDirect, and also please give your suggestions and comments. We definitely encourage negative comments, and also send it all these your comments by WhatsApp message to this number. And thank you very much for your kind attention.